Assalamualaikum warahmatullahi wabarakatuh. Hello guys, good morning ladies and gentlemen. How are you today? I hope you are good. I would like to say thank you for coming to this video. Me and my friends, we are going to learn about risk for aspiration. Okay? First, let me introduce myself and my partner. My name is Nita Damayanti and my partner is.
Hi guys, my name is Lulu Munawaro.
Hello, I am Riskiyah. We are from Group 10. We are from the fifth semester of Nursing Undergraduate Study Program, Hafsyawati Zainul Hasan Genggo High School of Health Science. Okay, are you ready to learn about this for aspiration? Okay, the I have I have divided my talk into a few sections. The first is definition of risk for aspiration, and second about risk factor, and then about goals and outcomes. Finally, I will explain about nursing assessment and nursing intervention. Now, I will explain about definitions of risk for aspiration. Definition of risk for aspiration is at risk for entry of gastrointestinal secretions, oropharyngeal secretion, solids, or fluids into tracheobronchial passage. Aspiration is breathing in a forage about objects such as foods or liquids into the trachea and lungs, and happens when protective reflexes are reduced or jeopardized. An infection that develops after an entry of food, liquid, or vomit into the lungs can result in aspiration pneumonia. Inhaling chemical fumes or breathing in and choking on certain chemical. Even small amount of gastric acid can damage lung tissue, resulting in chemical pneumonitis. Many household and industrial chemicals can produce both an acute and a chronic form of inflammation in the lungs, which can place patients at risk for aspiration. Acute conditions like post-anesthesia, effects from surgery or diagnostic tests happen predominantly in the acute care settings. Chronic conditions like altered consciousness from head injury, spinal cord injury, neuromuscular weakness, hemiplegia, and dysphagia from stroke, use of tube feedings for nutrition, and artificial airway. Defects such as tracheostomies may be experienced in the home, rehabilitative, or hospital setting.
Okay, next is about risk factor. Here are some factors that may be related to risk for aspiration. The first, advanced age and anesthesia or medication administration and decreased gastrointestinal motility, delayed gastric emptying, and depressed cough or gag reflex, and drug or alcohol intoxication, and facial, oral, or neck surgery or trauma, and impaired swallowing, and increased gastric residual and tube feedings. Okay, next is about goals and outcomes. The following are the common goals and accepted outcomes for risk for respiration. The first, patient is free of sight of aspiration and the risk of aspiration is decreased. Second, patient expectorates clear secretion and is free of aspiration. The third, patient maintains a patient airway with normal breath sounds. And the fourth, patient swallows and gets oral nasogastric or gastric feeding without aspiration.
Now, I will explain about nursing assessment. Assessment is required in order to distinguish possible problems that might have led to aspiration as well as name any episode that might occur during nursing care. The first assessment assess level of consciousness. The rationalist, the primary risk factor of aspiration is decreased level of consciousness. The, the assessment monitor respiratory rate, depth, and effort, not any signs of aspiration such as deep new cough, cyanosis, wheezing, or fever. The rationalist signs of aspiration should be identified as soon as possible to prevent further aspiration and to initiate treatment that can be life-saving. The last assessment review results of swallowing studies as ordered. The rationalist for risk patient performance of a video fluoroscopic swallowing study might be indicated to determine the nature and extent of any swallowing abnormality. The nursing intervention. Nursing intervention. The following are the therapeutic nursing intervention for risks for aspiration. The first intervention keep suction machine available when feeding risk patient if aspiration does occur. Suction immediately. The rationalist. A patient with aspiration need immediate section and will need further life-saving intervention such as intubation. The intervention inform the physician or other healthcare provider instantly of not decrease in cough or gag reflex or difficulty in swallowing. The rationale early intervention protects the patient airway and prevent aspiration anyone identified as being at high risk for aspiration should be kept NPO, nothing by mouth, until further further evaluation is complete. The last intervention kept kept head of head keep head of bed elevated when feeding and for at least a half hour afterward. The rationale maintaining a sitting possible after meal might help decrease aspiration pneumonia in the elderly. Okay, everyone, our presentation is complete. If you have any question, please leave a question in the comments column. Thank you all for your attention. I hope today's presentation is useful for all of us. Wassalamualaikum warahmatullahi wabarakatuh. Assalamualaikum. Good night, Miss Lulu.
Waalaikumsalam. Good night, nurse.
Okay, introduction. My name is Nismita. I was nurse on duty this night missing time. How are you feeling today?
I feel good.
Okay, well, at this time, I will do a vital signs check on you. This check takes a few minutes. Are you willing?
Yes, I'm ready.
Okay. Okay. First, I will measure blood pressure using tensiometer and stethoscope. Excuse me.
Yes, please.
Excuse me dulu. Excuse me dulu. Okay. And then I will measure body temperature using a thermometer and will put it in the armpits of you. Excuse me. Can you lift your arms?
Yes, I can lift it.
Next, I will measure the pulse using a fingers. Excuse me.
Yes, please.
Okay, Miss Lulu, do you feel it hard to breathe?
No, I breathe so I don't feel sense of breath.
Okay, okay. Missing time check is done, and now I will take the temperature. Excuse me.
Yes.
Okay, Miss Lulu, I have finished taking potassiums. According to the result of the examination of maternal blood pressure of 130 per 80 millimeter sphygmomanometer plus 90 time per minute and body temperature 37 degrees Celsius. Well then, let me at first if you want something, please contact me in the nurse office.
Yes, nurse. Thanks, nurse.
Okay, you're welcome. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Thank you for watching.